Dr. Tracy Tyson, board certified general pediatrician. And what is this rash? This is eczema in a baby or atopic dermatitis. This is the most common skin rash in children, and it's really difficult for families and babies and hard to get a hold of. So I think one thing to remember is that eczema is chronic, so it is going to come and go and come and go. There is no cure for it, but it does get better over time. It's usually genetic, and it's a defect in the skin barrier. So the skin barrier lets the moisture out, and then it allows all the irritants in. And so when there's a defect in that barrier, that's how you get eczema. So what can you do at home to help your baby's eczema? First and foremost, you didn't cause it. It's rarely associated with food allergies, but it can be. So certainly follow up with your pediatrician if you're noticing it worse with certain foods or severe eczema. So in mild to moderate eczema, we want to think about what causes it, what can trigger it when we think about treating it. So first and foremost, really being diligent with moisturizing. You want to use something thick and non-irritating. Some common examples would be Aquaphor, Vaseline, CeraVe Healing Ointment. Something that has a nice little salve to it, no scents, dyes, perfumes, irritants, things like that. Keep it as moisturized as you can as many times throughout the day. When you give your baby a bath, you want to use a really gentle cleanser, and they don't need cleanser over their entire body every single day. So when you give your baby a bath, don't use the soap until the very end of the bath. We don't want them sitting in the soapy water and continue to leach out all of that moisture. When you get done bathing them, rinse them off really well, and when they're still slightly damp is when you want to apply all of your moisturizers. So kind of lube them up head to toe, get them nice and moisturized. You can use something called a wet pajama technique, where you put on a pair of pajamas that are slightly damp right up against the skin. You put another pair of pajamas on top of it. Your kid will actually love it because it's really soothing, and then they sleep in that overnight. They wake up and their skin looks and feels so much better. In the morning when you're putting on your moisturizers, dampen the skin a little bit first before you put those moisturizers on. It helps it penetrate through the skin barrier and helps it work a little bit better. If your child is super itchy and uncomfortable, you can use children's Zyrtec, especially at night, so they can get a little bit of rest when it's irritating them. This can be triggered by certain times of the year, certain detergents, so always use free and clear, and it can be triggered by infections, can be triggered by teething, dyes, perfumes, anything. So pay attention to the triggers, see if you can figure out what your kids' triggers are. If you're doing all those things, if you're watching for the triggers, if you're treating it with a moisturizing salve, you're using the wet pajama technique, you're using Zyrtec at night, and you're still not noticing improvement in your baby's eczema, follow up with your primary care provider. There's lots of treatments for this, but I wanted to give you some ideas of what you could do at home and how you could help your kid on a regular basis. I hope this helps. Take care.